Late in September 2012, when Scott Pelley of CBS News interviewed Governor Mitt Romney, one question in particular revealed something peculiar and unsettling. Pelley asked, "Does the government have a responsibility to provide health care to the 50 million Americans who don't have it today?" Romney replied promptly, "Well, we do provide care for people who don't have insurance. If someone has a heart attack, they don't sit in their apartment and die. We pick them up in an ambulance and take them to the hospital and give them care. And different states have different ways of providing for that care." Pelley then followed up with, "That's the most expensive way to do it." One must wonder how removed they both are from the real world. Neither showed any appreciation for the value of human life. Uninsured people cannot afford to see doctors and have regular checkups. Lives are often saved by preventative care, diagnosing, and checkups. Blocked coronary arteries, high cholesterol, hypertension, and other serious conditions can be addressed and treated before they result in heart attacks and strokes. Romney claimed they don't sit in their apartment and die, which is misleading and false. They do die. Did Romney evade the truth purposely? Is he simply uncaring or just oblivious to how people actually live and die in the United States? He must be aware that by the time many of these uninsured people reach the emergency room with a heart attack, many of them either die during transit, in the ER, or after arrival. Many survivors will suffer irreparable damage and will be forced to apply for Social Security disability benefits. The lives of millions of Americans are threatened because they are unable to afford medical care. What happens to those who survive but cannot afford follow-up care? They die prematurely. This is not a problem that upper-class Americans experience, but to middle-class Americans who don't have Medicaid, it's a life and death issue. Yes, we all pay for health care to cover the uninsured who receive treatment in the emergency room. Is that the real tragedy? Pelley challenged Romney's comment with, "That's the most expensive way to do it." However, Mr. Pelley left out something vitally important: the value of human life. The life of an uninsured person is precious, even if many of the wealthiest of Americans like Mitt Romney are insensitive to this fact. The news broadcaster and the candidate present a callous and myopic perspective. For them, the cost of the uninsured is more important than the lives of the uninsured. The 50 million uninsured people are just numbers, a faceless crowd of second-class citizens. Let us remember, however, that this uninsured class of Americans help pay the taxes that provide health insurance for those who govern over them. A 49-year-old uninsured man named Matthew suffered a heart attack on Thanksgiving Day in 1999. He was completely unaware of his heart condition before the incident. The man was uninsured because the insurance companies excluded him due to a pre-existing condition. As a loving father and the sole supporter of his devoted wife and 4 sons, the impact of his demise would have been profound. Moments after Matthew's pulse grew silent and his blood pressure bottomed out, miraculously he came back to life. Days later, they took him from the critical care unit at Sarasota Memorial Hospital to undergo a heart catheterization to repair his occluded coronary arteries. When he was prepped and lying on the surgical table in the cath lab, he nervously spoke to the cardiologist. "I promise to do everything I can to repay you. I hope that you will be careful and treat me well. Because there are some people who care deeply about me. I have a wife, 4 sons, and some dear friends who love me." The physician put his hand on Matthew's shoulder and replied, "Do not worry. I will treat you as if you are my own brother. In fact, you will never receive a bill from me. Just say a prayer for me and we can leave it at that." Tears silently slipped from Matthew's eyes. The procedure went well, but permanent heart damage and previous health issues prevented him from returning to work. Matthew is now receiving Social Security disability benefits and Medicare. He is a dedicated artist and writer, sharing a loving and meaningful life with his family and friends. I know this story is completely accurate and factual because I am that man. And I believe that my life is just as valuable as Mitt Romney's. Should Americans die because they cannot afford health care or cannot qualify for health insurance? Just think about it. How many uninsured Americans help pay for the health insurance benefits given to the members of our Do-Nothing Congress? The thrust to move this nation to universal health care under a single-payer system is not only ethical, it will save lives and build a stronger nation. Let us remind the Christian evangelicals in America, Jesus did not first ask the leper what kind of insurance he had before performing the miracle of healing. This is Spadecaller.